things are happening quickly now, especially with the COVID-19 pandemic. And so much of what we're talking about today is kind of what we talked about just a few weeks ago, but so different. Just so much has changed. And if you were on that last webinar earlier this month, you'll see that I've updated the information. And so this is current as of this morning. We were updating the unemployment claims and stuff that came out just yesterday, so that today's slide deck reflects the latest information that's available. So I want to encourage you to ask your questions, whatever question you have related to drug-free workplace, drug testing, COVID testing, keeping in mind that, 4 months ago, there were no COVID testing experts. And so myself, like so many others, we're just trying to get up to speed on the technology, on the laws that can affect it. But I've got some slides towards the end on legal considerations. I'll share that with you as well. I just did a webinar on Monday with the Yvette Farnsworth, who's our on-staff attorney here at the Current Consulting Group on legal considerations. And I'll share a little bit of what Yvette used in her portion of that webinar on Monday. But first, we'll talk about the impact of COVID-19 on substance abuse and substance abuse in the workplace. And then we'll talk about how you should update your policy right now in anticipation of the end of the pandemic, and people are already coming back to work in some industries, and then how to protect your workplace from the coronavirus. And then we'll talk about enhancing and expanding your program, lab-based oral fluid testing, and Jeff referred to remote video observed or telehealth collections, which is an area that just almost didn't exist in workplace drug testing last year, and now it's just picking up speed and becoming not common by any means, but more and more requested as employers are looking for ways to keep their drug-free workplace programs going and making them robust and effective. There are alternatives that were perhaps not as popular or even considered a year ago that are now sort of at the forefront of drug testing in the workplace. And so let's start with a couple of slides that set the stage for what we're going to talk about. And this is a slide that I used last time, but I've updated it. So we know that substance abuse is on the rise. And according to all the studies that are out there post other national emergencies like 9/11, like Hurricane Katrina, etc., it's going to stay up there for a while as people continue to self-medicate for months and months and months to deal with the discouragement, the depression, the anxiety, that comes with unemployment, that comes with the company you used to work for being out of business now, et cetera, et cetera. So substance abuse is on the rise, and it's likely to not come down for many months to come. And as of yesterday, there were nearly 47 million people. Last time we did this, I think we used the figure 36 million or 40 million. But as of today, as of Friday last week, that's when the report was based on, 47 million people have applied for unemployment. And 47 million people were employed 4 months ago, and they're going to be coming into the workplace looking for a job again as the economy, I think, accurately stated, slowly begins to open up again. And so as employers sort of prepare for that, and you're already sort of seeing that happening, although we hope a sort of a second wave of the coronavirus doesn't slow this down or slow it down too much, you've got to be proactive in making sure that your workplace is prepared for that it's safe and that it's clean, that your employees, your clients, your customers can come into your workplace and feel safe and feel secure. Even if they're still wearing a mask, even if some still wear gloves, that they can come into your workplace and know that you're doing your part to make sure that your workplace is both drug-free and clean and healthy. And I think pre-employment testing is a big part of that, as well as background screens as employees come back into the workplace. I'm going to talk a little bit about some new information from the U.S. Department of Transportation regarding pre-employment testing as the workplace opens up again in several slides in today's presentation. But now's the time to be ready. Now's the time to prepare because you've got the time to do this now. And it's an important issue. And so this is usually the slide I end this type of presentation with, but I moved it up to the top. Let's start with the end in mind, okay? So in anticipation of the end of the pandemic or some sort of return to normalcy, now's the time to review and update your drug testing policy, making sure that it complies with all applicable state laws. Whenever I get asked that question, which law applies to my multi-state company, I always say all of them. You must comply with all state laws that apply to your company. If you're in 10 states, then you must comply with all 10 state laws. And so you want to make sure as you review and update your policy that you're taking that into consideration, as well as the ever evolving state of legal marijuana. Last year, there were 450 bills introduced at the state level among state legislatures that could have had, and in some cases have had, a direct impact on drug-free workplace programs and drug testing in particular. And the majority of those bills, those 450 bills, were related to marijuana. So it's an ever-changing area of law, and one that affects the drug-free workplace efforts of employers all throughout the country. 34 states have legalized marijuana, 11 states have legalized it for recreational use. So it affects a lot of us, if not almost all of us. And then making sure, of course, in today's environment that your workers and your unemployment comp laws are built into your policy. Every state has workers and unemployment comp laws, but many states have drug testing and drug-free workplace language in their workers and unemployment comp laws that protect you as an employer. And so you want to make sure that your policies include that information. Make sure you get your supervisors trained and get their training up to date, whether it's DOT required or non-DOT, providing drug education for all of your employees, and then looking at different types of drug testing methods and drug testing support services. Jeff mentioned lab-based oral fluid testing. Very popular right now, as many employers continue to find it difficult and challenging, if not impossible in some places, to get a urine sample collected. And so oral fluid, which is a very simple, easy collection process, it's really employee or donor driven, and the collector is really more of an observer to the process. That becomes an easy way for employers to continue to do drug testing without having to worry about sending employees or applicants to an occupational health center, perhaps, when they don't want to go there at this time. That will change over the course of time, and people will be comfortable with that again in the future. But for now, it represents an alternative that allows you as an employer to continue to have your drug testing program in place without having to worry about some of these new challenges that are the result of the COVID-19 pandemic. Point of collection testing is an option, both with oral fluid and urine, and saliva alcohol testing is another option. I get asked this question every time I mention that. Does DOT allow saliva alcohol testing? And the answer is yes, they always have, going back 25 years. But you have to use a saliva alcohol screening device that appears on the federal conforming products list. And so you want to make sure that it's an approved device, and if you've done that, then you can use it for DOT mandated alcohol testing as well as non-mandated alcohol testing. And then, of course, making sure that your workplace is safe, it's clean, it's healthy. Lots of new considerations there vis-a-vis the COVID-19 pandemic. We'll talk about that a little bit later. But let's move on to the first section, which is the impact of COVID-19 on substance abuse in the workplace.
Hey, Bill.
Yes.
I'm sorry to interrupt, but it looks like we may still be on the title chart. I just wanted to confirm that you're progressing through your presentation.
I am, and I know how to correct that. Okay, so you'll recognize these slides from things I was talking about earlier. Okay, and now we're going on to the first section. Thank you, Jeff, for pointing that out.
Sure, thanks, Bill.
Okay, so cost to employers can be quite high. Substance abusers are responsible for a lot of absenteeism. They're less productive than their coworkers. They're responsible for a huge percentage of employee theft, for workplace fatalities and accidents, workers' comp costs, etc. Look at the last bullet. 17% of the average workforce in the U.S. is made up of substance abusers. That's according to the federal government report that comes out every year, the National Survey on Drug Use and Health. And each substance abuser costs his or her company, on average, $7,000 per year. And that's according to a study that was conducted by the U.S. Navy. Keeping in mind that when the Navy did their study, it didn't include some of the things that the private sector would be concerned about, like workers' compensation costs. That would drive that $7,000 figure up a little bit. So if you consider 17% of your workforce being substance abusers, and you take your number, maybe it's 100 employees, and you take 17%, that's 17 workers, and you multiply it by 7,000, that's the cost of substance abuse to your company. Now compare that number to the cost of your drug testing program. Let's say that you conduct even 200 drug tests a year, and you're paying $100 a drug test. You're probably not, but let's say that you are. Well, compare that number to the 17% of your workforce, the 17 times 7,000, and your return on investment from drug testing is still significantly in your favor, in favor of drug testing. It always comes out ahead. Substance abuse is very expensive. By comparison, drug testing is very economical and just a smart business decision in many, many different ways. Now, what do all of these companies on the screen have in common? I mean, you see some very well-known, very famous companies, right? JCPenney, for example, Tuesday Morning, Hertz and Advantage Rent-A-Car, Gold's Gym, Neiman Marcus, Pier 1. What do these companies have in common? Well, they've all filed for bankruptcy since the COVID-19 pandemic began. In 2020, coming into this year, the Department of Labor estimated that bankruptcies before coronavirus were up 14% in the first quarter of 2020. As a result of coronavirus, they're now up 20% compared to the same time last year. And the industries that have been hit the hardest are retail, travel, and the oil industry. And the oil industry. And that's important because it affects what you and I do with our drug-free workplace programs. It affects how we address this issue. So unemployment trends. Now, this is a study that, it's an article about a study that was just published June 20th on the foxbusiness.com website. Another 1.48 million Americans filed for unemployment benefits last week. So we're talking about just last week, signaling a slow economic recovery from the coronavirus pandemic and related lockdown as layoffs remain historically high, even as many businesses have reopened. The latest jobless claims figures from the Labor Department, which covers the week ended June 20th, pushes the number of job losses since the shutdown began to around 47 million. So that goes back to that first slide where we talked about the number of people who have become unemployed since the coronavirus pandemic began. Now, let's switch to drug abuse just for a moment here. So we know that drug abuse is on the rise. Coming into this year, it had increased every year for the last 4 years. This is according to SAMHSA. And marijuana is the drug that's fueling that increase as it's legalized in one state after another. And the age group of users that have the highest level of marijuana use are those, as you can see, between the ages of 18 to 25. That's that middle grouping of bars there, beginning with the blue, the orange, the gray, and the yellow. That's the group of 18 to 25-year-olds, young adults, and they have the highest level of marijuana use compared to teenagers to the left and 26 and older adults to the right. Keep that in mind as we look at this next chart. This is the rate of unemployment among young adults through the end of April. It had skyrocketed from a low of 7.7% to 27.4%. That was as of the end of April. So what does, in fact, let me see if I can skip ahead here just a minute. There's actually a new report, and I might have this slide coming up a little later in the presentation. So let me just back up for a second. There's a new report that shows that as of the end of May, the unemployment rate had dropped among this group to 25.2%. So imagine it's still at just an astronomical level, but it's come down. And that should be good news, right? Except that during the coronavirus pandemic, as many of these unemployed Americans, and especially this age group of young adults who have the highest rates of marijuana use, as they come back into the workplace, more of them now versus January and February, for example, are using drugs or are using more drugs. And so I found this one study that appears on a website called medscape.com. It's not their study, but they're reporting on a study that talked about the levels of substance abuse, as it says, in the wake of the coronavirus pandemic, and the communities that are already affected by what they call the rising deaths of despair. So during times of a national emergency, like Hurricane Katrina, that's one of the ones that they quote, 9/11, of course, there's something called deaths of despair where suicide rates go up, where people become more depressed, more discouraged, and they start to self-medicate to try to deal with that state of mind that they find themselves in. And according to this study, those rates are highest in the Midwest, the South, and the Northeast. And I don't know why I didn't get far enough. I'm not sure it even explained why. But look at the last sentence of that first bullet. Moreover, through isolation and social distancing, they will be deprived of people in their lives who provide support, which is essential to resilience. Now, I only point that out because as we continue to have lockdowns and businesses that are not opening, this isolates people who may be struggling to begin with their support group, which may be their workplace and their coworkers. And so we want businesses to reopen for lots and lots of reasons, but also for the mental well-being, the mental health of these 47 million people who have found themselves unemployed. Look at the second bullet. The study says, even if we weren't already facing massive unemployment, we would probably still see more substance use problems among those affected by our current disaster. We don't yet have studies on the COVID-19 pandemic, but the research that we do have on substance use illuminates what's ahead for our country. And so this was a study of 547 people who were exposed to different types of disasters, floods, tornadoes, as you can see there. And the most common condition was alcohol use disorder. That's what they refer to it, which typically predated the disaster just as much as substance abuse predates COVID in already economically stagnated communities of this country. So second bullet, this highly prevalent psychological distress following disasters fosters self-medication. And so go to the last bullet. Many survivors of Hurricane Ike were found to turn to alcohol. After Hurricane Katrina, substance abuse disorders in New Orleans soared. And after the events of 9/11, we know that substance abuse went up dramatically. So one report showed that among Manhattan residents, 30% said that they drank more alcohol, smoked more cigarettes, and used more marijuana in the first month after 9/11, and that number only came down slightly 6 months later from 30% to 27%. And so we can assume, we can conclude almost without any doubt that this national emergency, the COVID-19 pandemic, will have just as devastating an effect on the levels of substance abuse and mental health in our country. And that affects our workplaces. As millions and millions of people start to come back into the workplace, many of them will be coming back with more experience using drugs, more drug addiction, more dependence on drugs. And so if you take the number coming into 2020 of 53.2 million people admitting that they were illicit drug users, and you apply that 30% increase from the post 9/11 study in Manhattan, we're looking at not 53.2 million, but about 70 million substance abusers. In other words, we've gone from 1 in 5 to 1 in 4 people being substance abusers right now. And that's only according to this one possible estimate, certainly not a scientific approach, could be higher than that. In fact, I can tell you that there was a study done of the SAMHSA survey that comes out every year that gives us the 53.2 million. There was a study done of that survey that found that the results are about 30% understated. So in other words, that 53.2 million is probably 30% higher than that, which would make the 70 million higher as well. The point is that there are just a lot of people using drugs right now, and the problem for us as employers is as they come back into the workplace, as we're flooded with opportunities to hire people, which we want to do, we're going to have more positive drug test results. This was just a study that was done at the end of 2019 on positivity rates from one laboratory between the years 2015 and 2018 that showed the industries that had the highest rates of positivity or positive drug test results. So as you can see from the quote up at the top, retail trade is one of 6 sectors that saw year-over-year double-digit increases, and then you go down to transportation in warehousing at 34%. Now that doesn't mean 34% of employees in that industry, but they saw a 34% increase between 2015 and 2018. Public administration, 33%, wholesale trade 20, retail 14, almost 15%, construction 13.2%, and administrative support, waste management, remediation services 12.2%. Interesting, isn't it, that these are the industries that saw double-digit increases in positivity rates, and this was all prior, of course, 2015 to 2018, all prior to the COVID-19 pandemic circumstances that we find ourselves in, with significant increases in substance abuse. And this all costs us money. There's no way to get around the fact that substance abuse costs employers money. And there's lots of figures on the page. I'm not going to read them all. But the point is that, and I remember years ago, somebody came to the conclusion, I think it was the United Nations, came to the conclusion that workplace substance abuse was costing the United States like $2 billion a year, some astronomical number. This was back in the early 90s. And I thought to myself at the time, that's not really going to register with most employers, because $2 billion is beyond what their company generates in revenue typically. I mean, unless we're talking about some of the biggest companies in the world, you and I run companies that are, you know, at a much different revenue level than that. So what's it really mean to me? And that's why I provided that statistic where 17% of the workforce are substance abusers, and they cost on average about $7,000 a year. Well, 17 times 7 is a number I can deal with, because I can see that in my company where 17% of my employees may be substance abusers, hopefully not, but at a rate of $7,000 a year, that number means a lot to me as a small business owner. And if you're a company with, say, 1,000 employees, well, it means a lot to you as well. And so we need to be able to equate the cost in dollars with the rising level of substance abuse so that we understand why it's so important to keep doing this. A lot of companies are going out of business and they're not coming back. And all of those people who worked for them are going to be looking for jobs just like everybody else. And they're going to be knocking on our doors, and we need to be ready for that. So let's talk about your drug testing policy for a second, because one of the things I said at the beginning is take the time now to update your drug testing policy. And this was the results of a report by the National Safety Council back in 2017 that showed that 81% of employers who participated in their survey didn't have a complete drug-free workplace policy. And if you go through all of those line items on the left, as you go from top to bottom, you see things that were missing from their policy. So just to take a couple of examples, employee use of medical marijuana, 45% said their policy covered that, 16% were unsure, and 39% knew it didn't cover medical marijuana. And yet medical marijuana is a hot button issue that should be covered in every company's drug-free workplace policy. Go down to the where it says employee use of prescription drugs at work. 67% covered that. That's much better. 12% not sure. Still 21% of employers don't have any mention of prescription drug abuse or what the consequences might be in their drug testing policy. So this is the time to make sure that your policy covers all the areas that you want it to. One of the first things that we do when we write a policy, and I'm sure this is true of anybody who writes policies, is we ask our clients, what is it that you hope to achieve with this policy, with this program? And once we understand what your objectives are, then we can help you write a purpose statement for your policy that then provides the guidance and the blueprint for the rest of the policy. And so all of these issues that you see lined up here on the left are all sort of articulated in the policy based on what you hope to get out of your drug testing program. So if you sort of broke your policy down into several key categories, the components of your policy that have to be in place, you would start with that purpose statement, defining why the policy is being implemented, why you're drug testing, or why you're updating and bringing your policy in line with new laws and new objectives of the company. And then who will be covered by it? Job applicants, all employees, maybe only employees in safety sensitive positions. Which drugs will you test for? The standard 5-panel drug test, marijuana, cocaine, opiates, amphetamine, and PCP, or an expanded panel. You can test for many different drugs today, and an expanded panel is not uncommon. Say a 9 or a 10, 11 panel drug test is not uncommon nowadays. Identifying how candidates' employees will be tested, What methodology? Are we talking about urine testing, oral fluid testing, hair testing, or some combination of those different methodologies? That gets articulated in your policy so that employees understand this is how I will be tested. I will be expected to provide an oral fluid sample or a urine sample, etc. And then under what circumstances will testing occur? Pre-employment only, post-accident, reasonable suspicion, maybe random testing. Very important nowadays with COVID testing, maybe a return to work policy. Let's say, for example, that if somebody tests positive for the coronavirus, they're asked to stay at home for, say, a 14-day self-quarantine period until they can produce a negative test for coronavirus. But maybe during that time, because we know from other studies and other statistics that are available that people are sort of self-medicating through this crisis, maybe they've been using drugs. And so as a return to work or a pre-duty test or a pre-access test, different names for it, you might want to also ask that person to pass a drug test before they come back to work after a 2 or 3 week self-quarantine period for coronavirus. Define what a refusal to test means and what the consequences are both for a refusal as well as for a positive test. If all you're doing is DOT mandated drug testing under, say, the Federal Motor Carrier Safety Administration guidelines, then a lot of this is sort of already decided for you. You get to decide under the DOT regulations, you know, if you're going to terminate someone's employment or not. But you're not allowed to choose, you know, between random testing and pre-employment testing, because those are both mandated under the DOT regulations and under the Federal Motor Carrier Safety Administration regulations. But if it's non-mandated, if it's by company authority in a non-mandated scenario, then you decide those things based on the requirements that are part of the state drug testing laws that apply to your company. And as I said, all of the states that you're in are applicable to your company. So you're going to want to have, excuse me, addendums to your policy for each of the different states that have restrictions or guidelines that are different from your main policy statement. You're also going to want to train the supervisors who are responsible for the enforcement of your program. And very importantly, I mentioned this already, but so important, make sure your policy has a dedicated marijuana section. That's just so important nowadays. Those marijuana laws are different from state to state. One of the things that they almost all include is language that prevents you as an employer from discriminating against a legal user of marijuana. But they also typically contain language that specifically says that you are not required to allow individuals to use marijuana in the workplace or to allow them to be under the influence of marijuana in the workplace. So you want to make sure you have a marijuana section in your policy. Your policy is going to talk about the different methods of drug testing and alcohol testing that you use. And so we've already talked about these. You're going to have access to these slides, but I just wanted to kind of give a couple of pros and cons for each testing method as you see on the screen. I'll just pause here for a minute. So for example, because Jeff mentioned lab-based oral fluid testing earlier, you can see it's endorsed by SAMHSA. It's great for recent use detection because it detects the parent drug and not just a metabolite of the drug, which is the case with urine testing. It's legal in 47 states. Maine, Vermont, and Hawaii still don't allow it at this point. Collections are simple and easy to do, but a very big caveat here, it's not yet permitted by DOT for DOT mandated drug testing. That's a big thing. So if you're a mandated employer, if you're covered by the DOT regulations, for DOT drug testing purposes, you can't use lab-based oral fluid testing. You still have to use lab-based urine testing. But these are the different options that you have. And of course, with alcohol testing, you also have the option of saliva versus breath. Background screens, I'll just say this, and of course, the folks at Orange Tree are experts in this. They can tell you a lot more about it. I just think it's critical. I think a background screen in conjunction with the drug test is a very strong, healthy combination of screening that helps give you the comfort of knowing that you've done everything you could possibly do to make sure that this new hire or this person may be returning to work after some type of leave of absence is somebody that you want on your workforce, that you can trust and have confidence in. And the background screen helps you do that beyond what a drug test can do. There are other screening methodologies that are out there. There's pupillary exams for impairment testing, other types of screening tests and evaluations that can be done. But I think the combination of a drug test and a background screen is a perfect combination. And we did a survey years and years ago through the Current Consulting Group, and the vast majority of employers said they prefer to purchase their background screens and their drug testing from the same provider. And that just makes things a lot easier if you're doing that all in one place with the same provider. And while we're on the subject of pre-employment screening, let me just say this about pre-employment drug testing. And this was something that I said during the webinar that we did earlier this month, that pre-employment drug testing is legal in every state. And I emphasize that because there are some people, according to our surveys, the survey that we conduct at Current Consulting Group at the beginning of the year, employers who weren't sure whether pre-employment drug testing was still legal because they live in a state that has passed a marijuana law that places restrictions on pre-employment testing for THC. Say Illinois, for example, or Nevada, which have very restrictive marijuana laws when it comes to pre-employment screening for THC. But even in those states, even in marijuana, or excuse me, in Illinois and Nevada and Arizona hasn't passed their law yet. New York City, which has the most restrictive pre-employment drug testing law in the country, even in those places where they've placed significant restrictions on pre-employment screening for THC, even in those states, you are allowed to pre-employment screen for THC of workers in designated safety sensitive positions. In other words, the lawmakers didn't want applicants for safety sensitive positions to not be tested for THC, even though they wanted everybody else to have sort of a free ride on that. And it tells you something about what we all know about THC, which is people that are under the influence of marijuana for some period of time after the initial use are just not safe employees. They're not safe workers. They're not people who can perform safety sensitive functions without complications. And even the lawmakers who passed those restrictive laws realize that. And I only stated here, not for political purposes. I mean, my position on marijuana is probably very well known in the drug testing industry, but so that you understand that pre-employment testing is legal everywhere. You can pre-employment test for all drugs, including THC in most states, but for heroin, for cocaine, for psychotherapeutic drugs, in all 50 states. So pre-employment testing is very important, especially as we go into the post-pandemic, reopen environment. Now, let me just say this. Well, I don't have a slide on this, but let me just point out that last week, the U.S. Department of Transportation put out a statement, a new guideline that said that as the economy starts to open up and as businesses start to reopen and start to rehire, that a pre-employment test is not required of a worker who was furloughed because of the pandemic and who was subject to random drug testing during that furloughed period. So if you're hiring somebody new out of the blue to drive trucks for you, then that individual under DOT regulations would still have to pass a pre-employment drug test. But there's a waiver in place for workers who were furloughed during that period. A little bit more complex than what I'm saying right now, so I suggest and recommend strongly that you go to the DOT website, to the Federal Motor Carrier Safety Administration guidelines in particular, to read that statement so you understand it completely. But that's the gist of it, that there is a waiver in place. It only applies to furloughed workers and not to all workers. And as I mentioned earlier, just make sure your training is up to date so that your supervisors, your managers, the people who are responsible for your program have their training updated. That's something that's too easy to get behind on. Now's a good time to get caught up because you can do it online and have everybody recertified and have their certification up to date very quickly. Now, in the closing minutes that we have, let's talk about COVID-19 considerations in the environment of a drug-free workplace program. So as I said, I did a webinar on Monday on this topic, and here's the Reader's Digest version of this, okay? Employers can temperature check. They can test for COVID infections that are current or live infections. They can test job applicants in a post-hire, meaning it's a conditional offer of employment. but they can conduct a job applicant COVID test. And they can let people go or send people home who refuse to be tested or who are showing the signs and symptoms of a coronavirus infection. Employers cannot only test some employees and not others. In other words, all the tall people are going to be COVID tested and the rest of us won't be COVID tested. Or the people with full heads of hair versus the people with what I consider to be very attractive partial heads of hair, they'll be tested. You can't do that. You can't discriminate when it comes to COVID testing and drug testing for the most part, although there are some legally accepted forms of discrimination testing with drug testing. And before anybody writes in and says, what are they? Well, you can just have a drug testing program for safety sensitive workers, even outside of the DOT regulations. That's permitted in almost every state. But you can't single out employees based on risk, like everybody over the age of 65 will be tested and anybody under the age of 65 will not have to be tested. And you can't ask employees about their risk factors. These are all still things that are covered under the Americans with Disabilities Act, even though a COVID infection is not yet been designated as a disability under the ADA. There's still certain protections that apply. And you can find all of those guidelines on the EEOC website, the Equal Employment Opportunity Commission website. Now, let's talk specifically about just a few issues real quickly. Temperature check, yes, but only based on current COVID conditions. In other words, the EEOC has determined that COVID presents a direct threat to the health and the well-being of the public, including employees. And so certain restrictions that might otherwise apply to what would be considered a medical exam, like a temperature check, are waived. But you've got to continue to monitor those guidelines from the EEOC, from the CDC, and these other federal websites, because it could change. Some things have changed recently. In other words, the EEOC just put out guidance on what type of COVID testing you can do in a workplace environment. And I still need to do a little bit of research on there, but they're making a distinction between an antibody test and a viral test. And I'm going to talk about what those are in a second, but allowing one and not allowing the other. So I'll get to that in just a couple of slides. But the EEOC considers the COVID-19 pandemic a direct threat, and so they've waived some restrictions that would typically apply to quote unquote medical exams. And so temperature checks, okay to do under the guidance that we have from the EEOC. What about COVID testing? Yes, again, based on COVID status as a direct threat. If that should change, then there would probably be restrictions on workplace COVID testing because it would be considered a medical exam, whereas a workplace drug test has been determined not to be a medical exam, okay? Look at the second bullet. However, because this is based on the threat of COVID transmission, employers cannot test employees who work from home. So if you have a home-based workforce and they're working remotely from their homes, they cannot be tested for COVID. They're not posing a threat to anybody. I mean, maybe just in their own household, and they're not coming into the workplace. Now, if they're coming into the workplace, even say 2 or 3 days a week, then you could probably justify submitting to or requiring a COVID test. But the EEOC has specifically stated that applicants can be tested, but it must be done post-offer. And that word is misspelled there, and apply to all people applying for the same job. So a couple of restrictions there. You can do pre-employment COVID testing, but it has to apply to everybody that's applying for the same job. But you can't test employees who are working from home, okay? And continue to check to see whether COVID's still considered a direct threat by the EEOC. Can employers test only certain employees or applicants? Well, there's a lot of guidance on this on the EEOC website and some really good information on the CDC website. But let me just take you through these bullets real quickly. And I apologize, I jumped ahead here. I will tell you that who pays for a workplace COVID test? Because a COVID test is considered a medical exam, even though there are waivers in place right now from the EEOC, most states require employers to pay for medical exams that the employer requires, okay? Back to the previous slide, all employees or applicants for the same category must be treated equally. And if you go down to the second, I think it's the second bullet, if an employer wants to test only one employee or only a few individuals rather than a whole category, They must have a reasonable belief based on objective evidence that this individual is positive for COVID. So there are some exceptions from a legal standpoint that could apply, but you want to make sure that these things are written into your COVID policy. You could have COVID policy language built into your drug test or into your employee screening policy, but it needs to be in writing somewhere so that your employees and your applicants have something that you can refer them to that explains how the company treats this. Let me talk about the difference between a viral test and an antibody test. So generally speaking, a viral test is a test that will determine whether somebody has a live infection right now. And an antibody test will tell whether somebody has had an infection in the past, but not necessarily a live infection. Now, keeping in mind with both testing methods, the viral test and the antibody test, there's a lag time of some period of days before an infection or the virus will become detectable in that test. And so you could test negative in a viral test today and positive tomorrow, because only by tomorrow will it have been enough time for the virus to become detectable. I'm not a scientist, and I'm not trying to pretend to be a scientist. I'm learning these things just like everybody else is on the job. But the difference between the two is the difference that the EEOC is amplifying when they're saying that a viral test that shows a current infection is permitted for workplace testing, and an antibody test that doesn't show a current infection, just past infections, may not be permitted for workplace testing. And I say may not just because I want to go back and study that language again to make sure that's what it's saying, but that's what I thought it said when I read it 3 times the other day, that an antibody test would not be permitted for workplace testing and a viral test would be. And I say all of that with this caveat, which is that could change tomorrow. You know, the two types of testing methods could be completely switched because all of this is happening so quickly and changes are occurring basically every day. The coronavirus can be detected in blood, in nasal samples, or samples from the nasal collections, and also from oral fluid. Oral fluid is sort of the testing method of choice. That's where the science, the technology is drifting towards, just because the collection process is so much easier, non-invasive, and non-painful to the donor, and that the virus has been accurately detected in saliva. So we seem to be going in that direction. If you look at that last bullet, one study was entitled "Saliva is more sensitive for SARS-CoV-2 detection in COVID-19 patients than nasopharyngeal swabs." So a lot on COVID. Tie it into your drug-free workplace program. Make sure you're using a device that's at least been cleared by the FDA or has an emergency use authorization from the FDA. Otherwise, you really don't know the quality of the test. There have been reports out there of devices that are being sold and used to COVID test that have a 30% fail rate. And so with an FDA cleared device, or more likely an FDA issued emergency use authorization, you're more likely to be using a product, a testing device that provides accurate results. And it all comes down to that last bullet, the sensitivity and specificity levels, the chance of a true positive versus the chance of a true negative. And you want that to be really high. You want those in the product insert language for whatever COVID test you use. You want sensitivity levels and specificity levels to be up in the high 90%. And so if you're looking at a device with a sensitivity level, the chance of a true positive at 80%, then you can expect a 20% fail rate or 20% false positives. In specificity levels, you're looking at false negatives. So very important that you look for a device that has the EUA designation. And then all the other things that you can do and should do to make sure that your workplace is clean and sanitized on a regular, ongoing basis. And just in closing, I would just say that, you know, there's just so much information coming out on drug testing right now, and on the COVID-19 testing side of things. Just constantly be looking for updates. Orange Tree can help you with that, of course. They provide this information. The webinar that we're doing today, this is such a great thing because not all providers are doing this. And so I really commend Orange Tree for putting out this kind of information and making sure that it's available to you, their clients. Just keep in mind that as things are changing, you've got time to get ready. We're only seeing a slight percentage compared to the big number of people that have been coming back into the workforce. The flood of people returning to the workforce is still to come. And now's the time to get ready with your drug testing policy, your training, looking at different types of drug testing methods to make sure that you have some flexibility there, and then doing what you have to do to establish a safe, clean, and healthy workplace, which may or may not include COVID testing, but probably in most cases, I think we'll see many employers providing some type of a COVID policy that includes some form of COVID testing, maybe pre-employment only or return to duty more likely when people have been away on a leave of absence related to a coronavirus infection coming back into the workplace. I think you'll see a lot of companies doing COVID testing under those circumstances. But that's a lot of information real quick. I realized I was talking quickly. You'll have these slides, but I'm available to answer any questions that you may have now or even after the webinar. Jeff, do we have some questions from our audience?
You know, at this time, we don't. We did have a point of clarification. I think one of our attendees today, he is on top of the subject, was pointing something out, and then it showed up on your chart on slide 34 relative to virus testing versus the antibody. So I think we have an informed audience. We do, to your point, try to keep our clients, our prospects up to date on what is pertinent to them, even in what I would consider to be a somewhat of a fluid situation here with the COVID-19 coronavirus testing. I guess in that spirit, Bill, on behalf of our clients today, what are you telling when you're out consulting and people are asking the question, what do we do? And I say that in light of, you just mentioned a moment ago that things are changing and continue to look at these websites, but I mean, businesses are in the moment now. They have work they're doing today. They're trying to develop policy today, and yet something changes next week, 2 weeks from now. How do they wrestle with that?
Well, so I think I made mention of this earlier, but through the Current Consulting Group, we just completed a survey of the drug testing industry and a parallel survey of employers on the state of their drug-free workplace programs vis-a-vis the COVID-19 pandemic. And what we've found is that probably a very unacceptable percentage, although it wasn't a majority by any means, less than 20% of companies have suspended their drug testing programs, as one example of how companies are responding to this. And you think on the one hand, well, you know what, we don't have a lot of workers in the workplace right now, or they're all working from home, or any number of justifications a company might have for that. And my response to that has always been, and now we've got this data to go along with it, that this is the worst possible time to suspend your drug testing or background screening if you're hiring new people, because substance abuse is going up dramatically right now. We're not talking about, from year to year to year, you see very slight increases. They may be statistically significant from a statistician standpoint, but they're small increases. We don't go from, say, 17% of the workforce having the substance abuse problem to 25% a year later. That would not be normal. But given what's going on with the pandemic, knowing that alcohol sales are up, that the sale of medical marijuana and other forms of legal marijuana are up dramatically since the start of the pandemic, you could be assured that your employees are using drugs at home, or they're consuming alcohol, or they're going to come back into the workplace as you start to open up your facilities again with probably more of a problem with substance abuse than they had beforehand. Some of them maybe had stopped using drugs or didn't really use drugs at all, and now there may be a greater possibility that they are using drugs, especially among young adults who are in that 16 to 25 category. And so my advice is stay vigilant, keep your program going. Even if it doesn't apply to a lot of people right now, keep it going, keep it fresh, and also look at the possibility, definitely have a COVID section to your policy, but look at the possibility of COVID testing. Because in the end, and I hate to be sort of all business about this, but in the end, most companies drug test because it affects the bottom line of the company. You can't generate the revenue to justify your bottom line, then companies go out of business. And that, we saw that big list of companies that have all filed for bankruptcy. So, the bottom line is always the bottom line to some extent, and you owe it to yourselves as employers, to your board of directors, you owe it to your investors, but even more so, you owe it to all the employees who count on their job with you to make sure that your company is drug-free, that it's safe, that it's healthy, and that you're doing everything you can as an employer to make sure that there's a job there for all of your workers tomorrow, which is no guarantee if you back off on drug testing, if you back off on COVID testing, if you back off on background screening for new employees. You just really don't have that guarantee. So my advice is keep doing what you should be doing. Don't give up on it. Don't slow down. Don't cut back. The virus will end eventually. We'll all get back to some form of normalcy in the future. And you don't want to sort of be starting from scratch when that happens.
Bill, as always, thank you very much for that guidance, and overall, thank you for this wonderful presentation. I would echo you do talk fast. I give you credit for that, but boy, I tell you what, you've got a lot of data, and maybe we should have scheduled 90 minutes with all of the data that I see listed in those charts. But to your point, there is a handout, everyone out there, as part of the tool. We will send out a reminder email that has links, and if you'd like to share that with other colleagues, feel free to do so. Thank you for attending today's webinar, and have a wonderful day. Bill, thank you again.
Thank you.